Called the Town of Fairfield Board of Health meeting to order at 7:40 on June 14th. I guess we'll go ahead and skip the approval of the minutes because we don't have enough members here to approve the minutes. And so the rest of the meeting is really for informational purposes only. Sands, would you like to give your report?
Sure. So I'll start off by sharing my screen, which hopefully will have it down now. All right. So essentially just trying to give a flavor of what's going on with some of the data, COVID data. So right now in Fairfield, we're at 5,251 cases and 207 deaths. And as you can see with some of these graphics here, these are some of the most recent from the state. You know, our cases are continuing to go down. We're actually case-wise, we're probably at the lowest point since the start of the pandemic. You know, even the summertime, the big lull in the summertime that you see sort of somewhat over here. The hospital admissions is still a little higher than summertime. Hospital census is still slightly higher than last summer during the pandemic, and the deaths are not quite as low as they were at summertime a few months back. So good thing in terms of cases, and hopefully the remaining variables will continue to follow. I thought I would share some of the vaccination coverage data that we have. And so on the top row of this up here, you'll see, you know, of the total population of the US, fully 43.7 are fully vaccinated, with 52.5% at least one dose. So that's where the average for the country is. And if we scroll down here and look at where the state is, so the state is about 9 percentage points higher, with 52.49 fully vaccinated over here, and 60%, 60.22 have initiated. And then just to show what Fairfield is at, and I'll kind of straddle the screen here. So Fairfield fully vaccinated down here, using the same numbers as the state, same numerator denominator as the state, 57.75 is fully vaccinated. So we're about a little over 5 percentage points higher than the state, and 65% that have initiated vaccination. When we look at, you know, the state came out with a number that said, well, they're, you know, they're above 70% for initial vaccination, and we played around with the numbers of how they achieved that, and essentially they moved the those who aren't eligible yet, so the 12% of the population that isn't eligible yet for vaccination, to come up with that number. And when we looked at that same thing, when we looked at least the data we could get, so what we could get 15 and above, we don't quite have local data for 12 yet, but of our 15 and above, Fairfield's at 71% fully vaccinated. Oh, it's a good thing, you know. And then if you look at this graphic over here, you can see the breakdown of the ages. So starting at the bottom row here, this 65 and older, we're at almost 91% fully vaccinated, 65 and older, and 95.5% that have initiated vaccination. So those are some very good numbers. Even the 45 to 64s are, you know, just about 80% fully vaccinated, 86, almost 87% initiated vaccination. So the reality, the number will land eventually somewhere between those two, closer to the, you know, the initiated percent, most likely, because usually most people finish it once they start it. And then the 15 to 44, we're still doing okay, still higher than the state in terms of fully vaccinated at 55.8 and initiating vaccination at 66.1. So that's just some of the data that's available on that Connecticut data portal that, you know, I've been sharing with the staff, and I thought I would share with the board tonight. And so this other shows some initial indications of state data for statewide level, not at town level, but 12 to 15-year-olds, where they're at least as of the 9th, 15.9 or 16% fully vaccinated, and 38.1 initiating vaccinations. So just thought I'd share some of that data there. This is for those that are the data geeks amongst us that look at this stuff and think about where and how we can do better. And so in that light, I thought I would show, this is just some data charts on deaths that we saw, and then I thought I would go down and show you this chart here is this is the breakdown of, and I'll show you the section here it's fully vaccinated. These last 6 rows are people who are fully vaccinated and the percentage of that population by their race ethnicity. So you can see that for non-Hispanic Native Americans in Fairfield, and this is Fairfield specific data, 97.7% vaccinated. Non-Hispanic Asian Pacific Islander is 56.7% fully vaccinated. Non-Hispanic Black, 28%. Hispanic, 59.8%, and non-Hispanic White, 52.2%. So, a pretty big, range there in terms of that. And so that's sort of what we've been in terms of both age and see, I think I'm done with this now. I just got to figure out how to stop sharing. So in terms of age and of ethnicity, we've asked, so we have some capacity available due to the decrease in cases. So we have some contact tracers that are available. And we brought on a couple staff that help with our clinics, some part-timers and some seasonal staff this summer. And so they've been helping us reach out to try and address some of those gaps that we're seeing. So we've reached out to all the senior housing facilities, all the group homes, all the supported housing, and we're working with some of the coordinators of those facilities and those services to sort of target how we can better reach their populations with vaccination or support them in getting vaccinated. And so that's one of our focuses that we're working on right now with that sort of extra capacity of the staff. So what's as I'm sure some of you are following, the Delta variant, the India variant is now, just this past week, has doubled in its prevalence in the United States, going from 3% of the cases to 6% of the cases, and some language that's being put out by at least CDC today saying, like the Alpha or the B.1.1.7, it'll likely become the dominant variant quickly, like B.1.1.7 did, and the Delta variant is now becoming is now in, I believe, in the UK, and I think it was France. It's now the UK and India, the dominant variant right now. And so, and some indication that it's more transmissible and causes it's more virulent, causes more illness. So we're keeping an eye on that. But again, everybody says that it's vaccination is the key to it. Current vaccines are effective against the Delta variant in reducing illness and hospitalization and death. And so, it's a push to motivate people to get vaccinated. And the CDC was saying just today that they suspect that if vaccination rates stay what they are now, that there'll be likely be outbreaks amongst unvaccinated individuals or partially vaccinated individuals in the fall at some point potentially. So, in our effort to keep vaccination going, in the last since our last meeting, we've had 9 different clinics. We've vaccinated almost 4,000 more people. We're up to 25,230 vaccinations administered. We've completed all the homebound. We had 185 individuals reach out to us or be forwarded to us by the state and by area hospitals, and have completed all those. On May 13th and 14th, we were able to get the Pfizer vaccine, and on the first day available, hold clinics for 12 to 15-year-olds, and did about 980 on our those first 2 days. And then on the 4th, we did a second dose clinic for that and got not quite 900 on that. So we had a number of them that didn't come back for their second dose with us, but I'm hopeful that they went other places. So we're continuing. We are winding down with our vaccination efforts. We are really not getting the last several clinics in May. We didn't get that were open for walk-ins. We got maybe the last clinic, I think, on I forget, it was the last Wednesday of the month, but basically I think we had eight people or something like that came in for first doses. So the demand wasn't there to hold mass vaccination clinics anymore for first doses. So this month we're wrapping up we did the second doses for the 12 to 15-year-olds, and then we'll wrap up with those that we gave first doses to in May, and then we'll likely stop for a time over the summer until the demand is there again. There's still plenty of vaccination opportunities in the area, so we don't feel pressure that we need to be, and there just isn't demand for mass vaccination sites like we are running. And so we'll instead focus on some smaller targeted types of efforts where it might be, sending a nurse and one of our clinic assistants, to a site to do 1 vial's worth of people, that kind of thing. So that's what we'll be potentially focusing on moving forward. So that's really the COVID news. We did have to close our beaches. We did have a rainfall that exceeded the closure criteria on the 29th of May. So we did have to close all the beaches. It was a significant rainfall. So we're getting right back into the things the health department normally does. We were able to fill our sanitarian A position. And so we'll have a new sanitarian joining us starting July 6th. And so we're happy to have a new qualified person coming in. And then the strike that we discussed last month at Regal Care, they ended up coming to an agreement, so they didn't end up going out on strike, which is a good thing. And then we are starting the process with our Health Improvement Alliance, which is a regional coalition of the hospitals and area healthcare providers. We're starting this will be our 4th community health needs assessment process that I know, Henry, you've been involved in coming to some of the presentations and being one of the key informant interviews. And so we're going to start that process again. We'll utilizing Data Haven again to run that, to do the data collection for us and produce the reports for us. And then lastly, we are continuing with our sort of weekly DPH, SDE, and CDC calls and planning meetings as needed. And then we were able to host a Fairfield Ludlow High School senior for his senior experience this year. And so the young gentleman, Quinn, was able to work in our clinic with the June 4th clinic that we did, and assist with some of the other activities around the department, doing water sampling and doing assisting with the restaurant inspections and the like. So we did have a student come and do 40 hours with us. So it was nice to get back into having that sense of normalcy of where we always had sort of had interns around and to be able to do that. So that is everything I had on my report.
Great, thank you. Does anyone have any questions? I had just a few questions. Since do we have, just out of curiosity, do we have any of the J&J vaccine?
I think we have just a little bit left, right,
Yeah.
Joe?
Yeah, we do.
Can you flash with your hands, Joe, how many?
No, she can. No, we can hear you.
On the phone. Hear me? Oh,
Yeah,
okay.
we can hear
I'm teasing you. I'm teasing.
Yeah, we. I think we have about 20 doses of J&J, and we just this afternoon had the expiration date extended by about 4 weeks, I think, until. Oh, I don't want to say anything definite. I
Right,
know
but there was an extension.
there was, yeah, and we got word of that.
Great. And then the other question I had was sort of in anticipation for the fall. Are there any plans to help with schools and either in-school vaccinations or plans for in-school testing if a testing plan needs to be developed?
So, Jill, I can let you, once you go on and talk about the in-school testing part, because you've been working with the schools on that.
Okay. As part of, well, I guess as part of the grant money that is given to, that's promised to the schools, we have to provide some degree of in-school testing with outside vendors. So we've made the application for that, and I've kind of done it for summer school first, because last year we did have summer school, and it was kind of a good testing ground for some of the mitigation efforts we had put in place in the fall. So I put in an application from the state to have testing at all of our, I think it was I think I did all 5 sites for summer school. There are a bunch of different programs that are going on. I handed all the paperwork in last week, Henry, and I just haven't heard anything from them.
Okay.
And as far as vaccinating, very similar to what Sans was saying earlier about the targeted groups, I had heard just anecdotally that some of the special ed students, the huge clinic, loud, noisy, a lot of waiting time was not exactly conducive, to their getting their vaccine. So we're going to survey the students who are in the extended year program, certainly 12 and up, and see if there's any interest for getting an in-school vaccination clinic going. So I'll probably do the survey prior to school starting, because I would like to get them, to and done, do it early, give them their first dose of Pfizer the first week or so of summer school, and then do the follow-up second dose in 3 weeks' time before school ends for them for the summer program. But that's it. We do not have at this moment. I mean, let's see how it goes. We don't have any plans, though, really, for in-school vaccination clinics. I think for the most part, it worked really well in the clinic that we have. I think that the feeling is that with the younger group, they would probably be more comfortable going to their local pediatrician as opposed to coming into the big clinic, because it's a lot. I mean, it's a very busy, loud, noisy clinic, so I can understand that. But Sans, I'm sure you'd be happy to start up another clinic for the under 12s if it came to that.
Yeah, I mean, I think there will be a demand for that. So we will strive to meet the demand of the community. The state has expressed several times that local pediatricians aren't responding as abundantly as they had hoped to becoming COVID providers. I think it may fall to us. Not ideal,
Right.
especially for the young
Right.
kids, because once one gets going, then they all get going, and
Right. And there's always that issue of parental consent, and having more people than you need sort of making their way through the system. So I think a big indicator is going to be what infection rates look like as we get closer to fall. So I think that's going to be a big driver of the need. But I'm glad that you guys are already sort of thinking about it, having it in the works, so that you're not having to start from scratch when we get to that point, if we get to that point.
yeah.
Right.
Yeah, the state definitely has resources available. So we can simply call up the state and schedule one of their SUVs to come down with a team and set up, and they'll do everything.
Right. Great. Mary Frances, did you have any questions? We'll just move forward, and if you do, just chime in. Jill, did you have anything that you wanted to report?
Actually, no, Henry. I told
Okay.
them this afternoon that I didn't do anything. We're just kind of getting back to normal with the usual, closing up of the school year and getting our state reports done, and transfer of information, student information from one level of school to the next. But really, nothing in particular. We finally did hire a part-time nurse for one of our private schools, and we're interviewing, and I'm actually, I should say that we're past interviewing for the full-time position. I just haven't made the job offer yet.
Playing from desktop 6PB0.
So that's it for me.
I did have a question, Henry, too, or a concern maybe. You had said in the beginning of the meeting that maybe like that, I think last year we had an August meeting. This year we're not scheduled to have one, but should we leave it open just in case there are some issues with kids going back to school, masked, unmasked, that kind of thing? It may come from the Board of Ed over the summer.
Yeah, we can always schedule an emergency meeting, but it's just
Yeah.
what we submitted to the town clerk as the official schedule of meetings for the year has already been submitted. And so that doesn't include the August meeting, but yeah, we can always schedule an emergency meeting if we have to.
Okay.
Sans, we just need to give how much notice?
As much as possible. I think 24 hours prior to the meeting is the minimum. We just have to give as much notice as possible.
Right. So yeah, I think as we get closer, we can certainly give people enough advance warning. But Mary Frances, I think that's a great idea.
Yeah.
You're right.
Have you
Things are
seen
gonna
all?
get geared up.
Have you seen the signs around town? Call
Yes.
the health department, unmask our kids. So yeah.
Connecticut
Not sure what
Department of
politically
Health.
it's going to be.
Yeah.
Oh, okay.
Great, fantastic. I don't know if this falls under reports or communications, but Sans, you referenced Sally Connolly's email.
Yeah.
And I will paraphrase it so that I don't put words in her mouth. But she had 2 points that she wanted to bring up. One was she was hoping that that there could be a push made towards unmasking of kids in school and in public, being that the infection rates have gone down, and I certainly think that I think it's fair to say that most people are in agreement that when it's safe, as it gets safer, that that's something that hopefully we'll move towards, and the state will certainly be taking the lead. I don't know if you have any other comments on that.
Yeah, I mean, I've seen the signs, and I've been contacted by several people, and I've responded. Essentially, the state is advising us that the current executive order simply requires masks at this point. That order doesn't expire until July 21st, and so, and at least until then, unless there's some change, the CDC is coming out with is currently working on guidance for schools that should come out some point soon. They were talking about it today on the CDC call. And then if there's a change there, or if the executive order changes, then we are looking to move towards the least restrictive stance as possible while still being protective. And so, but again, we have to comply with the laws, and the law currently is that the governor's executive order says, everybody's unvaccinated must wear a mask when indoors, and that the schools, you must continue the existing mitigation measures that are in place, including universal masking while indoors in schools. So even if you are vaccinated, and so that's the current stance. While I think, I understand people's desires, and I think we have to, at least, I think we're required to comply with the current laws related to that.
Great. And then the other comment that Sally had was she thought it would be helpful to encourage local Fairfield businesses to post their mask policy to reduce any confusion. And again, I certainly think that makes sense, that those locations or businesses that do require it, it would probably be very helpful to make that very clear. Being that it's optional in many cases as well. So.
Yeah, I can work with, probably Mark Barnhart is probably the best to work with on that in terms of just putting a request out there to, hey, clarify it on your front door, as people come in. I think it's a good idea.
Yeah. Great. Other than that, any other communications?
I have none.
All right. Any old business?
None.
Okay. Any new business?
Not at this time. Next month, if things come together as they will, the state had pushed off the annual report. So next month we may come in with some revised policies and standard operating procedures that we might seek board approval on. As it's required to be within a 5-year period for our DPH annual report. So we may have to update a few of those. So potentially next month we'll gather some policies and standing operating procedures for board approval.
Great. All right. Thank you. Well, unless anyone else has any questions, concerns, or comments, why don't we adjourn the meeting at 8:08?
Sounds good. Thank you.
Right. Thanks, everyone. Thanks, Mary Frances.
Great.
Thanks, Aaron.
Yeah. Thank you for the
Thanks.
clinics again. They were great. Thank you, both Sands and Jill. Thank you.
Thank you.
Bye now.
Good night.
Bye.